Treatment with respect to surgical management, our main goal is to focus on trying to repair this tissue. Now, sometimes that's difficult because most rotator cuff tears do not really occur from a traumatic event. Most of them occur through a chronic degenerative pattern, and what that implies is that it's poor quality tissue. So you can imagine if you have tissue that's of poor quality, it's very difficult to try and get that tissue to heal back down where it once was. So our main goal is to try and get it to heal, and there's varying techniques in regards to how to do that. Most techniques involve an arthroscopic approach where we will remove the bursa sac that lies above the rotator cuff that causes a lot of symptoms. Sometimes we'll remove a small bone spur that can sometimes cause symptoms in the shoulder. But our main focus is on the rotator cuff, and our treatment will depend on how big the rotator cuff tear is. Our main goal is always to try to get the rotator cuff back down to its insertion point on the humerus, okay, or the ball part of the shoulder joint. Most of the time we'll attempt to do this by putting anchors in the bone through which sutures are attached, and we try to weave the sutures back through the rotator cuff tissue and secure that back down to bone and allow that to heal. But sometimes the rotator cuff tears are larger, and we need to do other techniques to help assist in getting the cuff down to the bone. And we'll use different types of suturing techniques to try and get that cuff to heal. Even with our best efforts, again, it's a quality problem, so sometimes these rotator cuff tears don't heal. Interestingly, even if they don't heal, patients can still do well if you get part of the cuff to heal. So the rotator cuff you can think of as a tissue that comes about 3/4 around this ball, and if you can get the front 90%, okay, and the back 90% to be in balance, it still can perform well. So our main attempt is really to try and get this tissue to heal, but even if it doesn't heal completely, it still can perform well.